Good morning everyone. I am Dr. Sandeep Janardhan Tandil. I am a general and laparoscopic surgeon. Today's topic is a continuation of the previous video about the nail. In previous videos we have discussed about anatomy, various diseases related to the nail. This video I am going to talk about nail bed injury. Nail is not just a cosmetic part of our body. Nail gives a protection to your fingers whenever it comes in contact with any object. So it is a first defense for our fingers. Nail also gives an improved touch sensation. Whenever you touch any part with the finger pad, it gives a counter force. Nail gives a counter force and it improves the touch sensing ability of our fingers. The nail bed has a glomus body which helps our body or brain to identify the hot and cold surfaces. So another important function of the nail which helps the finger to identify the two-point discrimination. Two-point discrimination, like suppose you have two pointed objects like a pin, or you touch, then the distance between two points, you can understand that the 2 points are touching it, or even sometimes you can say that approximate how much distance it is. So when the nail is removed, like nail is completely removed, that 2-point discrimination widens. That is more farther when you put the 2 points, then you will identify. The less distance may not be able. That is how the nail is important. So in short, we will quickly discuss the parts of the nail, that is anatomy of the nail, so that you can understand when I am talking about nail bed injury. So the part of the nail, this is a hard part which is called as a nail plate. Then the part on which the nail plate rests is called as a nail bed. Then this is the whitish area, you see the half moon shaped whitish area, that is called as a lunula. Then this is a proximal nail fold and these are lateral nail folds. Proximal nail fold is also called as a cuticle. Just behind it is your germinal matrix. From germinal matrix the nail grows. And this part is called as a sterile matrix. It gives 10% growth to the nail, but it gives more fixing, like your nail plate is fixed to your nail bed because of the sterile matrix. So which are the common causes for the nail injury or nail bed injury? So most common causes are hammer injury. The people who are working in a carpentry industry, mechanical jobs, the injury due to the hammer, the crush injury because of that, the crush injury of the fingers due to the doors, like our house doors and most commonly the car doors, the fingers getting crushed in between them. Which age group, if you ask, commonly get affected is 4 to 30 years, but any age can get affected. This is the common age group. Males are more commonly affected compared to the females. I will just tell you why it is important to understand nail bed injuries should not be ignored. Okay, so whenever nail bed injury happens or nail injury happens, body will try to heal it. Any injury on any part of our body will try to heal it by scarring. It's important that if nail bed injury is there, it is repaired on time, or else that area will get scarred. Now what happens if it gets scarred? If it is scarred unevenly, like the nail comes straight and flat, if the nail bed, the area on which it rests, is damaged or injured, what will happen? Like one area might be up, one area may be down. So imagine how the next nail will come. Nail will come like up, it will never get fixed because it is not flat, so it won't get fixed in that area. So the problems, if not repaired, will be either the nail will not be in a shape, it will not stick to your nail bed, it will start coming and it will get avulsed easily. It will be split nail, or sometimes it might be the absent nail will never come in that area. So or you can get a recurrent infection in that area, soft tissue infections, like this nail folds will keep on getting infected. Sometimes the nails might come pokey, like sharp needles it will come. So these are all problems will happen if it is not corrected in time. So whenever nail injury happens due to whatever reason, like crush injury or fall or nail avulsion, it is important we rule out that nail bed is intact and there is no much injury to the even underlying bone. When nail is completely removed, the growth of a nail is like 3 to 4 millimeter every month. So a completely removed nail takes almost around 6 months to come back. In case of the toenails, that is the foot nails, it might take a long duration. It might be 1 year also sometimes. What happens is whenever you get a nail injury, if nail is gone, For first 21 days there is a stunted growth, that is there is no growth at all, or it is very very slow. After 21 days, next 50 days the growth is very fast. So nail will start growing very fast. After that 50 days, again nail will resume back to its original speed. So it will goes back to its speed of 3 millimeters every month. So what happens is, immediately after the injury, you will see a bump on the nail bed, like you will see something bulged area. That is because of this slow growth, then rapid growth, and then resuming back to normal growth. So you have to wait till 6 months to 7 months to see whether nail is coming straight or not. In nail bed injury, if the proximal fold, like this part of the nail fold is damaged, what happens is there are some special cells which are in behind this area which gives shininess to your nail. If that is damaged, your nail will become dusky. If the nail bed is injured significantly, like it is uneven, the next nail will be coming uneven. It might be a split nail. The scarring will hinder the formation of new nail. If in case there is a crush injury, fracture, and the nail bed is stuck into the fracture area, then it will be the new nail will not definitely come properly because the nail bed is crushed down. So all these factors are very important to understand, and it is important to show to the doctor or a consultant if you get nail bed injury, so that you have a good recovery of a nail. Nail growth rate is affected by the certain factors, like if a person is immunocompromised, that is his immunity is very less, a person on the chemotherapy, a person is having acute infection or the very severe illness, diabetic patients. In such conditions, the growth of the nail is slower compared to the normal individuals. So if we go for the clinical symptoms and findings, in a nail bed injury, what happens is either your nail is partially avulsed, there might be a blood inside that, it might be swollen nail, so it might be a fracture of the underlying bone. Now physical examination. So why physical examination of the nail bed injury is important? So what you can expect when doctor will see your finger? The doctor will examine your finger in two. One is with in anesthesia and one is without anesthesia. Without anesthesia means doctor will give local anesthesia in this finger so that you won't have pain. But before that, before giving anesthesia, doctor will like to see whether you have the sensation after nail injury, after crushing injury, whether there is a movement of the finger or not, to rule out any fracture, to rule out any tendon injury, whether the muscle and tendon is damaged or not, and whether you have sensation or not. Once you give anesthesia, the sensation will go. Doctor will not come to know whether there is a sensation persistent or not. And second will be with anesthesia, like doctor will give in anesthesia in that finger where it is injured, and then he will gently check whether the nail plate is came out, it is loose, came out from the bed, how much is the injury, underlying injury like nail bed injury, and then accordingly doctor need to take the decision about the further repair. Other thing why it is important to do examination is when there is a crushing injury due to any reason, like a door or hammer or any glass injury, whether in that part you have any foreign body like glass, any dust is there, any dirt is there, or any wooden piece, anything is there, doctor need to rule it out and has to be cleared off. If you don't go to doctor, sometimes it might get missed. So this is important that doctor do complete examination of the finger. All these things should be ruled out when you have a nail bed injury. Okay, so what investigations do you expect in cases of nail bed injury? Whenever there is nail injury, doctor will ask you to go ahead with a X-ray. Two views will be taken, the front and lateral, to see whether there is any fracture of the bone, underlying bone, if the nail bed is impinged in the fracture. So the treatment part, if the nail if you divide into four equal parts, like this, suppose this is a nail, I am dividing into 4 equal parts. If there is a blood in less than 25%, like 1/4 of the nail, if you see there is a hematoma or the blood, usually we don't do anything for that, it absorbs by itself. Provided your nail is intact, like it is no loose, not avulsed, and just there is a blood less than 25%, we don't do anything. If it is more than 25 to 50%, it needs to be evacuated. We have to rule out whether there is a nail bed injury or not, underlying fracture is there or not. If it is not there, just hematoma is there, doctor will drill few holes in that. Drill means make small holes in the clinic and evacuate the hematoma, the blood from that area. Once it is removed, the blood, then your nail plate will get fixed over there and new nail will come back. In case it is more than 50% and associated, if there is associated fracture of the finger, there is 90%, more than 90% chance that your nail bed is injured. When nail bed is injured, the bed on which the nail plate rests, it's important to find out whether nail bed is intact or not, because it should be repaired on the time. The doctor might remove your entire nail gently to see how is the nail bed, and if required, if it is injured, doctor will try to repair it with fine sutures, very fine sutures. Doctor will not unnecessarily remove the tissues from that area, because nail bed is very important. Even small pieces, if it is if it is a crush injury with multiple small pieces, doctor will try to keep them together and suture it and try to make it in a level so that the nail bed becomes even and nail comes back properly on that area. If your nail is avulsed, like suppose you see that your nail is avulsed, please show to the doctor, and doctor will take a decision whether to remove it or not. Like if the nail is still stick to the nail bed, if it has not came out of your nail folds, like from the sides of the skin, and doctor may give a chance of retaining the nail over there, see for a few days if it is holding or not. After a few days, if he feels it is becoming too loose, he might take it out. Doctor might prescribe you painkillers, antibiotics along with that. But if the proximal part of the nail, like suppose the initial part of the nail, this part is avulsed, it's important to rule out nail bed injury. Why? Because the deeper to it is your germinal matrix, sterile matrix, but germinal matrix is more important from where the new cells come for formation of the nail. So if that is injured, it's important to repair that part. So if the nail is avulsed from the proximal part, like this initial part of your nail, it's important to show to the doctor so that he repair it on time. If once it gets scarred, it's difficult to get a proper shaped nail. You might have to meet a complex repair for that. So the message from today's video, what I want to give is, if you get a nail bed injury or nail injury, if it is like very small, less than 25% of just blood is seen, it's not much avulsed, you can wait. But if it is more than 25% of the blood is seen inside, nail is avulsed in initial part of the nail, it's important, please show to the doctor to rule out nail bed injury. Because earlier you take care of the nail bed, better you get the nail. In my previous videos, I have discussed about how to take care of the nails, what are different moisturizers and creams are available. So I hope you understood this video and got some information out of it. If you have any queries, please type in the comment box. I will be happy to write about it. Thank you very much. Have a good day.